Dr. Randeep Guleria, the Director of the All India Institute of Medical Sciences, and Dr. Subhash Salunke, the Chief Technical Advisor on COVID-19 to the Maharashtra government, joins us as well. Dr. Guleria, since when have you started noticing, younger patients becoming COVID positive?
So I think as we've seen the rise in the number of cases in this peak, what we're noticing in the beginning is that the number of people getting infection are at a much younger age group, and also the type of infection they're getting is relatively milder right now to begin with. But I think that is something that we would expect to some extent, because the degree of exposure, the degree of travel, and the type of behavioral change that we've seen is much more in the younger age group than in the older age group. And because of the fact that they feel that COVID in them is going to be a mild illness, there is lack of COVID appropriate behavior, lack of wearing a mask, a lot of partying, which will lead to a spread of infection much more in the younger age group. The cause of concern that I have is that this will then move on to the older age group or those with comorbidities, because the younger age group people will take the infection to their house, and they may pass it on to the elderly who have a higher chance of having serious or severe illness. So therefore, it's something that we need to be very careful about. But as of now, it was seen in the UK also, that when there is an initial surge in the number of cases, it usually tends to infect the younger age group more than the older, because of the fact that older age group people stay more, let's say, confined, and they are a little bit more cautious as compared to the younger age group.
Dr. Salunke, in Mumbai, are you also seeing this situation in the last 1 month, younger people being infected in that 18 plus age group?
Yeah, I think obviously what Dr. Guleria is describing is actually happening in Maharashtra. We have seen this is happening right in the Vidarbha region. We are now witnessing it in Pune. We are witnessing it in Mumbai too. So as a matter of fact, let us appreciate that this younger population is the one which is going to be both from economic point of view, or their personal point of view, and from community's point of view. And we are now having a double-edged or triple, kind of a burden, wherein we have to take care of the older people, we have to now take care of the younger generation, even though comparatively the severity of the illness in this particular population is definitely lower. But at the same time, when you look at the denominator, if the number is so huge, and even if the percentage of the people going into complications will be lesser, the number itself is going to pose a serious challenge for the health systems. Right now it is in Maharashtra. Right now it could be seen in Delhi. But I am pretty certain that this will be a national phenomenon.
Dr. Guleria, is this a new mutation, strain, variant? Call it whatever you like, that is resulting in younger people being more vulnerable, like what we've seen in the United Kingdom, though it may not be that variant, not suggesting that.
So it's likely that there is a variant which is causing the virus to be more infectious, and this is part of what we tend to see. What is important to understand is that irrespective of whether it's the older variant or the newer variant, we need to have more data firstly to really see the epidemiological link with the various variants and the surge in the number of cases. But having said that, COVID appropriate behavior will look after even if it's a new variant, because wearing a mask, having physical distancing, avoiding crowded areas, and washing your hands will take care of any variant. We would have done that even if there was a new variant, let's say 6 months ago. But somehow we sort of have forgotten all of that, and that has led to this huge surge in the number of cases. Also, the whole philosophy of testing, tracking, and isolating has become a little lax. This is also leading to the spread of the virus in a large number of individuals in various states in our country.
Dr. Guleria, how would you respond to those who say that India never was very careful, people just never cared, and somehow or the other the numbers were declining significantly, and then all of a sudden, with the same behavior, the numbers started rising, which is why this talk of this variant is gaining. I mean, there seems to be logic in that.
Yeah, so that is a possibility. I don't deny that there is. This is exactly like you said what happened in the UK. that they were also in a better position somewhere in September, October, and then they had this huge surge before Christmas. And we are seeing that right now around Holi because of the fact that the same sort of situation is repeating itself. And therefore, it's quite likely that what has led to this increased surge is also the virus changing or mutating, and we would just need to link it with epidemiological data. But the fact that that data currently is not there doesn't mean it's not happening.
Right.
It's likely, logically, that if there's a certain surge in cases, there is something which is happening which the virus is now becoming more infectious, but it's also that we are allowing that to happen. We are allowing the virus to really spread in our own community because I would say from January, February, when we've had the vaccine rollout started, people have said that now COVID is over in our country. You have to just talk to the common man and he'll say, now there is no COVID, I can just go around.
No, it's a huge problem. No getting away from that, Dr. Guleria. Absolutely. COVID, there is no COVID appropriate behavior. It's a tragedy in this country and it's going to cost us. That said, Dr. Salunke, again, for the benefit of our viewers, why should it take so much time to make the epidemiological link between a new strain and clinically what you see on the ground? It's been, what, 1 month since we've seen this in Bombay, in Mumbai, other parts, Nagpur, for example, parts of Pune as well. Why are we having this discussion today when we are saying it's likely a new strain? Why aren't we at the stage when we say it is a new strain and we need to figure out if our vaccines work?
Absolutely. I think this reflects upon the kind of seriousness with which we are addressing this particular problem. Why we could not have more institutions, more laboratories to carry out these studies? How many samples we are checking? How many samples we are confirming? And as a matter of fact, this so-called mutant variant is not the critical one. This is not a critical issue at all at this juncture. The issue is that, what kind of a leadership we have. They are projecting themselves that, people can come together, have elections, this, that, everything put together. We are not giving a proper kind of guidance to our own people. Even from the laboratory capacity point of view, India could have done better than what we are doing at this juncture. We could have had the capacity built in such a way that we were in position to answer. Right now, we are saying that, is it because of the mutation? Some people say, no, it is because of mutation. While right now we are getting the indications that that is not very serious issue. So what is it? And because of such improper and imperfect information, there is a confusion among the people. And that is the reason at this juncture, more than the mutant variants, it is basically because we are trying to understand that whether mutant or not mutant, you can prevent the transmission by simpler appropriate behavior, COVID appropriate behavior. That needs to be focused upon. What is the example that we are giving it to the people?
No, absolutely, Doctor. I take that point very, very clearly, and perhaps we should have actually stepped up the number of tests, epidemiological gene sequencing tests to get more specific data. But I want to ask Dr. Guleria one more point, and I'm sure the doctor would welcome this. Now, outside in our country, Pfizer is saying, they've come out with their reports, their vaccine is 100% effective on 12 to 15-year-old children. Now, in our system, we have said that Pfizer can't come in now. They have to do all sorts of tests, this, that, and the other. Where does India stand now in terms of having vaccines which work on children? Because we never talk about children.
No, I think this is very important. If we really have to control the pandemic and have to get children back to school and be comfortable with that, we will have to look at a vaccine which is there for children itself. And I'm aware that both the vaccine candidates which are being used in India are doing studies to look at safety and the dose as far as children are concerned. Because remember, you can't say children are little adult. They are different in terms of both the dose that is required and the side effect profile that can happen because of the vaccination. So we need more data. But I would really say that if we are able to get more vaccines, whatever be the companies, that would be useful for our country, because that will allow us to vaccinate more and more people. And as we've been saying, that if we are able to vaccinate a larger number, we will be able to get some degree of immunity as far as the population is concerned. But the rider here is that we need to get enough people to come forward and get themselves vaccinated as we start cover the high risk group one by one. Currently, it's not an issue that we're running out of doses. The issue is that there are still a large number of vaccination sites where people are not coming, and we're not able to really fill that
but
gap.
So, doctor, why
we need
can't
to work on a strategy where we can actually really have enough vaccinations being done on a day, maybe ramp it up to 8 or 10 million a day, because that is what we will need to do if we really need to achieve our targets.
Dr. Guleria, one final question to you. The Punjab government is going from mohalla to mohalla, I believe in Ludhiana, identifying areas and then bringing in people. If, for whatever the reasons, people aren't coming, should the government not look at going to people in the most vulnerable areas and then telling them, please come outside your home, take the injection?
I agree with that. We have to look at a different strategy. And I think one strategy we need to look at is reaching out to the people. We need to develop a strategy where we can reach out to them and give them the vaccination, but doing it in a way that we are confident that we can take care of any adverse effect which happens. Remember, if we have a situation like that and we have a very serious adverse effect, it will be a huge setback to the whole program. So we need to develop a strategy where we can go from area to area, have a mechanism where you can set up like a small camp, have a healthcare person there, have an ambulance ready, have all the injections that you need for side effects available, and then you really go to that area and vaccinate as many people as you can who are in the high risk group, and then do that in multiple areas and move on. Okay. So I think a strategy like that needs to be developed, because we need to have a two-way mechanism. One is for people to come to the vaccination site, but also the vaccination site to go to the people. That will only be able to really help in increasing the number of people we vaccinate per day.
All right, I'd like to thank you both very much for joining us.